Thank you for coming here this morning, for sharing your stories, speaking about the different journeys that each of you have had or your families have had as you have dealt with long COVID. I want to follow on to what Senator Kaine has been talking about, which is being believed. And you have gone through an experience that has impacted you clearly physically. You've shared that. But we're living in a time and a place when everybody questions the reality of the facts on the grounds, whether it's politics or COVID or just so many different things. And that's hard. That's hard on the mental health as well. And so I would ask each of you if you can speak to the challenges that you may have had with regards to access to mental health care, behavioral health, because I have to assume that as you have been dealing with the physical effects of this, when you feel like you are being challenged by others, it's not real. You'll get over it. You are making it more than it really is. That has to be very stressful. That has to lead to higher anxiety. And that can lead to real depression. So if I can ask the three of you to share any thoughts that you may have on mental health and behavioral health access. We'll begin with you, Ms. Vasquez.
Yes, thank you. A large part of my out-of-pocket expenses have been for therapy, for mental health care. I was not, even in Los Angeles, was not able to find a mental health provider who was in network, who would see me regularly, and who didn't require me to drive an hour in traffic. So that's a big part of my expenses. I will say also, I have a history of PTSD and trauma before getting sick. And honestly, I think having depression in my health record contributed to the medical gaslighting that I experienced. I got a lot of, the mind has, really important impacts on the body. Well, the body has a lot of impact on the mind. So I think there's a social emotional piece to, my depression and my mood symptoms. And quite honestly, this is a neuroimmune condition, and brain inflammation has been shown to be linked to many mental illnesses and mood disorders. And so I 100% believe that as I get better care for my long COVID and ME/CFS, my mood will improve because my brain won't be as inflamed.
Ms. Beal.
Thank you. For me, for that access part of your question, the challenge for me has been getting an appointment with a neurologist. So I had a neuropsychological evaluation done, and it took me 9 months just to get that appointment. And in that appointment, you go through the different mental health diagnoses, and having depression that I didn't have before I was sick, and trying to figure out what caused the depression. Well, in my case, it's the long COVID. It's had that effect on me. I have insomnia, anxiety, all of that started when I got COVID and then long COVID. So that's been challenging. Like what you said, what the doctors are saying to you is the same for me. You need to walk more, you need to be in the sun, you need vitamin D, all of those things, that'll make you feel better mentally. And that might help, yes, but the long COVID is causing the anxiety and depression. So if I'm not treating the long COVID as it needs to be treated, then the depression and anxiety are going to continue.
Ms. Heim, do you have anything to add?
I think one of the things that has been hard for me with my daughter is that she kind of tells herself, well, I just need to work harder. I just need to study more. I just need to do this or that, and things are going to get better. And the fact is that's not true. One of the doctors we work with works with athletes, and they are studying it. And the more we push, the worse it gets. And that's very counterintuitive. But with this thing, we have to figure out a way to treat it without pushing, because what happens is you push harder, it gets worse, then you feel worse. And it's like this rapid cycle that just goes. And so they have to find a way. When she was doing physical therapy, they did go very slow on the recommendation of that pulmonologist that had the information. So again, it's about them getting the information so we can treat it properly and not create this cycle of depression and anxiety and, push and then get worse and.
Thank you, Mr. Chairman.
Okay, thank you. Senator Smith?
I think well, I don't think Senator Smith would ever defer to me in anything other than allowing me to speak first, because I have to go do a press conference and then get back here. But I want to echo the appreciation for all of you to